I'm Steve. You've been watching us. You also know that I'm here with Dr. Nario of Biointegrative Health Center because you can see him right there. Uh, welcome, Doctor.
Hi, Steve. Always a pleasure. Thank you for having me again.
So, you guys know that I really like the treatments and the IVs and different things that they have at Biointegrative. And I know that there's different methods for this, and my wife uh, probably gets some of these IV drips. But I want to talk about anti-aging drips. You got the bag right there, and it's an IV. It goes into your vein. But there's so many different things that people are looking at when they're talking about anti-aging. Their skin, they want to live to 120 or whatever it is. So tell us a little bit about, the things that you do at your clinic, yes, but you can get these done at other clinics. But just tell us about some of the anti-aging treatments that you can do.
Right. Well, Steve, as you know, we work with other specialties as well. And the thing here is when I hear anti-aging in commercially, they define this more of as cosmetic, aesthetic. And as we work with people like dermatologists, estheticians who has all these Botox, these services that they use for prevention of wrinkles, fixing lines in the face. So we do supplemental therapies with them, so that again, it can be potentiated, or it can be a standalone for anti-aging, or basically more of I guess a better skin or better physical outcomes for patients. So number one that we actually always have for our IVs would be biotin. You hear about this, about the benefits for hair, skin, and nails. It's usually called vitamin B7 or vitamin H, and enzymes rely on biotin to function. This vitamin is very important for energy production as well, and it helps the formation of fatty acids that nourish the skin. And another one that's very popular for us, as we give it through, again, in different ways, IV, injectable, collagen enhancers. And also with vitamin C. So, as we all know, collagen is essential and acts as support structure for the skin. It keeps the skin firm, plump, and gives skin the ability to retain moisture. Just picture a baby soft, rounded cheek. It looks nice and juicy because it's full of collagen. Starting around age 25, our body stops producing in as much collagen and eventually leads to loss of volume and firmness. Skin that was once plump and firm can look dry, flat, and papery. Think of the difference between toddler's cheek than an 80-year-old, right? We give our collagen stimulators for this reason. And as I mentioned to you, vitamin C is always required for the synthesis and support of collagen formation. And one more that is popular for this topic would be glutathione IVs. And there are a couple of ways in which glutathione helps with the whitening of the skin. Glutathione ties up with tyrosinase and blocks the pathway of the enzyme to produce melanin. So, meaning which the one, it's the pigment that turns our skin black or darker. The latter is the pigment that's, of course, as I mentioned to you, something that we want to avoid if somebody has one to have glowing skin. And the second way in which glutathione helps in skin whitening is by halting the activation of this specific tyrosinase enzyme.
Okay, so yeah, you talked a lot about skin and stuff. And now I know that you can also combine some of these, we'll call them medications or treatments together, right?
Yes, and they can act. You can get them in a session, in multiple sessions. They can be all combined, depending on the objective of the patient and what they want to achieve.
Yeah, okay. Appreciate the information. This is not something that you want to try in your garage, because mixing these things and getting in the right dose, and some things don't mix together, and one will cancel out the other, and you get no use out of it. So I know you have a lot of experience and education on how to do this. So that's important too, right? Don't try this in your garage. That's probably good advice.
Oh, Steve, and one more thing. One popular thing with anti-aging and also all these collagen, all these elastin in the face is exosomes or stem cells. I don't want to use the stem cell word, but it's exosomes. Those are the newer
Uh-huh.
ones now in the market, and yes, definitely those are things that are out there as options.
Is that an injectable, or is that an IV, or
Uh,
both, or?
right. Most of the time, it's an injectable. That's why it's something that really needs assessment. You just don't get that in a fly-by-night type of clinic. It really has to be very intricate in terms of who will receive it, where you get the source, and how it will be administered by your health provider.
Yeah, and the thing I like about that is that's natural.
Right,
So
right. That is true.
that's awesome. So if you guys have questions about this, put them in the comment section. Um, that's Dr. Nario at Biointegrative Health Center in Reno, Nevada. You can always call them or check out their website and find out more about what they do, or find out more about what we just talked about. So thanks for being with us, Doctor.
Well, Steve, thank you again. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.